In the past years, researchers determined that there is insufficient healthcare in China, such as the Yunnan province. In Yunnan, there are 6 healthcare professionals per 1,000 people, around 2,000 new cases of prostate cancer, and 900 deaths annually due to lacking resources. Prostate cancer is among the top 10 most common cancer cases in China. Furthermore, there are other persistent problems such as low income, the geolocational factors in rural China, and the social stigma against Western medicine. Therefore, we aim to formulate a cost-effective and viable solution to prostate cancer screening in this region.
Based on the stakeholders' needs, we produced 5 design criteria. Number 1, cost. The design mustn't exceed our capital of $738,000. Number 2, high sensitivity and specificity. For accurate diagnosis, the design should have an excess of 70% each. Number 3, portability. Since the infrastructure in Yunnan isn't dependable on, the design should be mobile. Number 4, operation requirements. The diagnosis procedures should be simple enough for clinicians with minimal training to operate. Number 5, efficiency. The design should be able to rule out patients without prostate cancer quickly and accurately. Our solution. This solution will take approximately 1 year to complete, 10 months for phase 1 and 2 months for phases 2 and 3. The first stage of our 3-phase final design solution is administering a pre-screening test for all men aged 50 to 60 in Yunnan. This test will involve a rectal exam, which will test for an abnormal prostate, in which the texture of the prostate is hard and bumpy. For a negative or suspicious result, the PSA test is administered. The PSA blood test measures the amount of prostate-specific antigen, PSA, in the blood. PSA is a protein produced both by normal and cancerous cells. Once a patient is determined to have a PSA level exceeding 4 nanograms per milliliter, then full-field optical coherence tomography (FFOCT) is used to diagnose a prostate cancer. In this newly developed technique, a biopsy of each individual will be taken and analysed by FFOCT. This involves a microscope coupled with an interferometer. A halogen light source is used to illuminate the tissue specimen and the interference signal is measured. Throughout the 1 year, funds will be allocated for campaigns to raise awareness of prostate cancer. Technical argument. We believe this solution fits the design criteria. Cost. We estimated that 8,000 people would need the PSA test administered, which at $16 each will take 17% of the capital. Furthermore, purchasing 5 FFOCT machines is viable, and we would still have an excess of $390,000 to spend. We will, however, require further financial sponsorship in order to keep up with the running costs for upcoming years. Sensitivity and specificity. The sensitivity and specificity of FFOCT are 100 and 96% respectively, ranking it more effective for diagnosis than even MRI. Requirements to operate. Clinicians with minimal training have had sensitivity and specificity values of 88 and 89%, thus FFOCT does not require much training. Portability and efficiency. Clinicians will make rounds door to door to conduct the rectal exam, which will take around 10 minutes. The PSA tests are no bigger than the size of a matchbox, hence they are conveniently portable. One FFOCT diagnosis takes 4 minutes. Lastly, we define sustainability as being environmentally and socially viable. Latex gloves are a big source of waste, but thankfully recyclable. Using the rest of our capital, $390,000, we aim to raise awareness and to provide advice and transport to major hospitals. This would make this project socially viable. In conclusion, the solution fits the design criteria and will positively impact the future sufferers of prostate cancer.